Hi guys. So let's answer the question on diclofenac. You tell us the group, mode of action, dosage, route of administration, side effects, indication, contraindication, and nursing responsibility of diclofenac. Don't mind my board, it's too small. Okay, so the group diclofenac belongs to a group of drug called nonsteroidal anti-inflammatory drug, also known as NSAID. So it inhibits cyclooxygenase, that is the cos1 and cos2 enzyme, which are involved in production of prostaglandin. Prostaglandin are chemicals that initiate pain, that is responsible for pain, inflammation, and fever. So what does it do? It go and stop this enzyme, that is going to initiate the production of this prostaglandin, thereby reducing prostaglandin synthesis. You get. So the dosage now in adults orally 10 milligram 2 or 3 times daily, and the maximum is 150 milligram per day. In IM injection, you have 75 milligram once or twice daily. In topical gel, you have to apply to the affected area 3 or 4 times daily, and it can also be used rectally in form of suppository. So that brings us to the route of administration. It can be administered orally, intramuscularly, topically, or as in topical gel or patch, suppository, rectally. So the side effects now, we have gastric irritation, nausea, vomiting. So let me tell you how you are going to form these side effects during exam. These side effects, you can get it from this route of administration. Since this diclofenac can be taken orally, and you know that it's bitter, you know, it will now initiate nausea. So that is nausea. And from nausea, it can lead to vomiting. You get. And this, you know that NSAID normally cause ulcer. That is this gastric irritation. And how we get this skin rash is that if you rub it, since it has topical gel or patch, it can lead to skin rash. So in some people, it can lead to headache, dizziness, elevated liver enzyme. So in indication, it can be used for back pain, arthritis, rheumatoid arthritis, during post-operative pain, dysmenorrhea, that is painful menstruation, gout, any form of arthritis. The contraindication is peptic ulcer disease, hypersensitivities to NSAID, severe heart, liver, or kidney diseases, pregnancy, especially in third trimester, history of gastrointestinal bleeding or perforation. Do not use in these cases, or if the patient has this condition, do not give or prescribe this diclofenac. So nurses responsibility. So just leave this thing. This one is advanced, nursing responsibility. But in case of exam, if your brain is blank, mm, just remember patient rights. Give the drug to the right patient, give at the right time, monitor for side effects, the right dosage, the right route of administration, this nursing responsibility. If you just write five, it's okay. But if you want to now, be advanced to tell your lecturer that you know what you are doing, you can now do this one now. You assess the pain level before and after administration. Before you administer this drug, you have to check, how severe is the pain? And after you administer the drug, you will now check for effectiveness of this drug, you know, to know if it work or not. So the second one is now administer after food to reduce gastric irritation. So you have to monitor for signs of gastrointestinal bleeding in form of black stool and abdominal pain. You monitor liver and renal function during long-term use. Diclofenac is used long-term. You monitor the liver and renal function. You educate on proper use and potential side effects. You are going to tell the patient to see this drug comes with dizziness, headache, nausea and vomiting. So if you see it or experience it, don't panic. And you have to tell them you have to take the proper dosage. Don't go and do, self medication and increase the dose you get. So the next one is now avoid concurrent use with other NSAID. This one is actually funny, because if you buy drug, over the counter drugs, chemist people now, if you buy, they will give you paracetamol, they will give you diclofenac, they even join ibuprofen to it. But all this drug, they have the same function, but they're going to pack it and give it to you. So this can now lead to severe side effects, or even cause immediate liver failure, or the constant use now will lead to serious liver damage. So this is everything you need to know about this diclofenac. So you see why you should join my private tutoring. Imagine I'm not being paid and I'm teaching you like this. What if you not pay me? How will I teach you? So the slot is still open. We are newly starting it because I was like, how can I help? I have this innovation to create this WhatsApp group to help, simplify all the difficult courses student nurses and midwife do find difficult. So make sure you DM me if you are interested, because you are not going to regret it.